What HbA1c level is diagnostic for type 2 diabetes? A. Greater than 6.5%. B. Greater than 5.7%. C. Greater than 6.3%. D. Greater than 7.0%. The answer is A. Greater than 6.5%. A hemoglobin A1c level of 6.5% or greater is considered diagnostic of type 2 diabetes. A HbA1c level of less than 6.5% does not exclude a diagnosis of diabetes, however, and should be looked at alongside fasting blood glucose and oral glucose tolerance testing. What is the most common cause of hyperthyroidism? A. Hashimoto's thyroiditis. B. Toxic nodular goiter. C. Graves' disease. D. Thyroid storm. The answer is C. Graves' disease. Graves' disease is the most common cause of hyperthyroidism. Graves' disease is an autoimmune condition in which antibody is produced against the thyroid-stimulating hormone, TSH, receptor, which binds to receptors, resulting in continuous stimulation of the gland to synthesize and secrete excess quantities of the thyroid hormones T4 and T3. Thyroid storm and toxic nodular goiter are less common causes of elevated thyroid hormone levels. Hashimoto's thyroiditis is the most common cause of hypothyroidism. What is the most common sign of primary hyperparathyroidism? A. Elevated serum phosphorus. B. Depressed serum calcium. C. Elevated serum calcium. D. Depressed serum potassium. The answer is C. Elevated serum calcium. The most common manifestation of primary hyperparathyroidism is elevated serum calcium. Parathyroid hormone, PTH, activates osteoclasts, which mobilize calcium and phosphate from bone. PTH also increases renal tubular absorption of calcium and inhibits the reabsorption of phosphate, resulting in elevated blood calcium levels while maintaining normal phosphate levels. High PTH has no significant direct effect on potassium levels. A male client presents to the outpatient clinic for care for recently diagnosed hyperparathyroidism. He has been undergoing care for this condition. The nurse recognizes this patient will be at risk for several clinical manifestations. All of the following are signs and symptoms associated with hyperparathyroidism except dash. A. Skeletal pain and backaches. B. Painful muscle cramps and tremors. C. Delirium and confusion. D. Kidney stones and urinary tract infections. E. Shortened QT interval on ECG. The answer is B. Painful muscle cramps and tremors. Painful muscle cramps and tremors are associated with low calcium levels, which is indicative of hypoparathyroidism. All the other choices are associated with high calcium levels and therefore are symptoms associated with hyperparathyroidism. A 35-year-old male client presents to the emergency department after wife found him unresponsive at home. The wife informs the nurse her husband is a diabetic, and had not taken his insulin for the past 2 days. The client appears flushed, breathing is rapid and deep, and has a fruity smell on the breath. The nurse suspects this presentation is diabetic ketoacidosis, which diagnostic finding would confirm this pathology. A. Elevated blood urea nitrogen, BUN. B. Serum bicarbonate of 23 milliequivalents per liter. C. Blood glucose 450 mg per deciliter. D. Decreased serum osmolality. E. Blood pH of 7.26. The answer is E. Blood pH of 7.26. The acidic pH is what is most consistent with the diagnosis of diabetic ketoacidosis, DKA. A pH of less than 7.30 is what is seen in DKA. The blood glucose will be elevated, but the nurse may also see a similar elevation in hyperosmolar hyperglycemic syndrome as well. The serum bicarbonate will be low and the serum osmolality would be elevated, yet both findings are not specific for DKA. Elevated BUN, blood urea nitrogen, is not specific for DKA as well. The nurse cares for a patient with a history of diabetes mellitus after a cholecystectomy. He has reported nausea and cannot have solid foods. Upon assessment, the patient appears disoriented and confused. Based on these observations, which of the following is the most likely explanation for the patient's condition? A. Diabetic ketoacidosis. B. Insulin resistance syndrome. C. Hypoglycemia. D. Hyperglycemia. E. Diabetic hyperglycemic hyperosmolar syndrome. The answer is C. Hypoglycemia. A patient's status post-surgery is often unable to eat due to nausea. A diabetic patient is likely to be suffering from hypoglycemia because of this. Confusion, disorientation, and shakiness are common manifestations of hypoglycemia as well. Hyperglycemia may present with blurry vision, frequent urination, headaches, and fatigue. Diabetic ketoacidosis can manifest with thirst, frequent urination, weakness, and fruity scented breath and occurs in patients with diabetes mellitus, DM, type 1. Diabetic hyperglycemic hyperosmolar syndrome may also present with the same symptoms of diabetic ketoacidosis but occurs in patients with DM type 2. Insulin resistance syndrome, also known as metabolic syndrome or prediabetes, usually does not present with manifestations, but people with severe insulin resistance syndrome may present with dark patches of skin on the back of the neck, elbows, knees, and/or armpits. You are taking care of a 66-year-old female who complains of weight gain, lethargy, dry skin, hair loss, constipation, and increased cold sensitivity. Based upon this assessment, you feel that the most likely diagnosis is which of the following? A. Diabetic ketoacidosis. B. Thyroid storm. C. Hyperthyroidism. D. Diabetes insipidus. E. Hypothyroidism. The answer is E. Hypothyroidism. This patient's constellation of symptoms is most consistent with hypothyroidism. In hypothyroidism, which may occur for a handful of reasons, the patient typically does not produce significant levels of thyroid hormone, T3/T4, and therefore, a variety of functions that are modulated by thyroid hormone are impaired. Common symptoms associated with hypothyroidism are weight gain, lethargy, hair loss, brittle hair, dry skin, constipation, depression, cold sensitivity, bradycardia, and brittle nails, among other symptoms. On exam, the patient's thyroid may feel enlarged. Characteristic lab findings would be an elevated TSH level with low or low, normal T3/T4 levels. The other choices are incorrect for the following reasons. 1. Hyperthyroidism would be characterized by opposite symptoms from those seen in this patients. Patients with hyperthyroidism would be tachycardic, anxious, have poor heat tolerance, diaphoretic, may have diarrhea, and weight loss among other symptoms. 2. Thyroid storm is a severe, life-threatening condition that is essentially an acute, severe manifestation of excess levels of thyroid hormone, also known as thyrotoxicosis, and presents with very pronounced, severe signs of hyperthyroidism. 3. Diabetic ketoacidosis is almost exclusively seen in patients with diabetes, which is not noted in this patient, and often presents with diffuse abdominal pain, rapid shallow breathing, altered mental status, and a fruity odor on the breath. 4. Diabetes insipidus would present with increased frequency of urination of dilute urine, fatigue, enuresis, dehydration, and/or electrolyte abnormalities. You are the nurse taking care of a 23-year-old patient who complains of anxiety, diaphoresis, palpitations, diarrhea, weight loss, and tremors. When examining them, you notice exophthalmos and eyelid lag. The most likely diagnosis in your patient is which of the following? A. Diabetes insipidus. B. Graves' disease. C. Hypothyroidism. D. Glucagonoma. E. Diabetes mellitus. The answer is B. Graves' disease. The most likely diagnosis in this patient is Graves' disease, which is a form of hyperthyroidism. Graves' disease is an autoimmune condition in which the patient produces autoantibodies to the thyrotropin receptor, which overstimulates the release of T4 and T3, resulting in hyperthyroidism and its associated clinical manifestations: anxiety, palpitations, weight loss, diaphoresis, diarrhea, tremors, etc. Further, in Graves' disease, patients may have exophthalmos and or eyelid lag, which are findings that are more specific to Graves' disease than other causes of hyperthyroidism. This patient's constellation of symptoms is highly consistent with Graves' disease. Hypothyroidism is not correct, as this patient is experiencing symptoms opposite those of hypothyroidism. In hypothyroidism, one would expect the patient to feel lethargic, weak, experience weight gain, dry skin, constipation, and potentially have depression. Diabetes insipidus would present with increased frequency of urination of dilute urine, fatigue, enuresis, dehydration, and/or electrolyte abnormalities. Diabetes mellitus would not likely present in this manner. Patients are often asymptomatic at the time of diagnosis, and it would be discovered by elevated glucose or HbA1c readings on routine laboratory work. Occasionally, increased urinary frequency and dehydration, or more severe manifestations like hyperglycemic hyperosmolar noctutic coma, HHNK, or diabetic ketoacidosis, DKA, would be a presenting scenario. A glucagonoma would present with necrolytic migratory erythema, most commonly, as well as severely elevated glucose concentrations. You are the nurse taking care of a patient hospitalized for 2 months for sepsis. The patient had been receiving 40 mg of prednisone daily for the last 2 weeks for airway inflammation, and now, for the last 3 days, given symptomatic improvement, his physician lowers his prednisone dose to 5 mg daily. Today, you assess the patient and he is lethargic and hypertensive, with a serum glucose of 52 and serum sodium of 131. Which of the following is the most likely diagnosis? A. Adrenal insufficiency. B. Connecticut syndrome. C. Surreptitious insulin use. D. Hyperaldosteronism. E. Exogenous testosterone use. The answer is A. Adrenal insufficiency. The patient had been on a prolonged course of a high dose of prednisone, a corticosteroid. When patients are on prolonged courses, and/or high doses of corticosteroids, this can cause a negative feedback cycle on the body's own intrinsic production of corticosteroids. As a result, high doses of exogenous corticosteroids, or prolonged courses of any dose of exogenous steroids should not be abruptly stopped, as the body's own intrinsic steroid production will not yet have recovered, and therefore, the patient will exhibit signs of adrenal insufficiency. In this patient's case, while the physician does not completely eliminate the patient's exogenous steroid dose, he tapers the dose way too abruptly, from 40 mg to 5 mg, which does not allow the body's own corticosteroid production to recover in time to meet the body's needs. Thus, the patient exhibits signs of adrenal insufficiency including lethargy, hypotension, hypoglycemia, and hyponatremia, hyperaldosteronism and Nclex syndrome. Primary hyperaldosteronism, are incorrect as these are the opposite of what is observed in this patient. In a patient with hyperaldosteronism, the patient would likely be anxious and/or have high energy, would be hypertensive, and hypernatremic, as the sodium, potassium ATPase's activity would be upregulated in the setting of excess aldosterone. Exogenous testosterone use would likely also cause increased anxiety, energy and hypertension, rather than lethargy and hypotension, as in this patient. Surreptitious insulin use could explain lethargy, hypotension, and hypoglycemia, but would likely cause hypernatremia rather than hyponatremia, as insulin upregulates the activity of the sodium, potassium ATPase, which would increase rather than decrease serum sodium. What hormone is elevated in Nclex syndrome? A. Aldosterone. B. Cortisol. C. Vasopressin. D. Adrenocorticotropic hormone. The answer is A. Aldosterone. Nclex syndrome, primary hyperaldosteronism, is hypertension due to elevated levels of aldosterone. High aldosterone causes excretion of potassium and retention of sodium, which leads to water retention and increase in blood pressure. While elevated levels of vasopressin, antidiuretic hormone, would also cause hypertension, Nclex syndrome refers to the hypersecretion of aldosterone. Which of the following genetic condition increases risk for development of diabetes? A. Turner syndrome. B. Klinefelter's syndrome. C. Downs syndrome. D. All of these. The answer is D. All of these. All of these symptoms are associated with a higher risk of developing diabetes. Turner syndrome is also known as XO, where the individual is a female, and is monosomic for the X chromosome. Individuals with Turner syndrome are also at higher risk of heart disease, and hypothyroidism, and they are sterile. Downs syndrome is caused by trisomy of chromosome 21, and involves elevated risks for mental impairment, heart disease, and certain cancers. Klinefelter's syndrome patients have the XXY chromosomal expression. They are at a higher risk than the classically male or female public for osteoporosis, hypogonadism, and cardiovascular disorders. What is the most common cause of Cushing's disease? A. Pituitary adenoma. B. Paraneoplastic syndrome. C. Renal adenoma. D. Corticosteroid use. The answer is A. Pituitary adenoma. 80% of cases of Cushing's disease are caused by adrenocorticotropic hormone, ACTH secreting adenomas of the anterior pituitary. High ACTH ends up causes adrenal hyperplasia, which leads to secretion of extra cortisol. Corticosteroid use is the leading cause of Cushing's syndrome, rather than Cushing's disease. How does insulin affect serum electrolytes? A. Insulin increases the permeability of many cells to chlorine, sodium and potassium ions. B. Insulin decreases the permeability of many cells to potassium, magnesium and phosphate ions. C. Insulin has no effect on serum electrolyte levels. D. Insulin increases the permeability of many cells to potassium, magnesium and phosphate ions. The answer is A. Insulin increases the permeability of many cells to potassium, magnesium and phosphate ions. Insulin activates sodium-potassium ATPase in skeletal muscle cells, causing an influx of potassium. Under certain circumstances, an incorrectly administered injection of insulin may kill patients due to its ability to acutely suppress plasma potassium concentrations. What mediates intracellular transport of glucose into the beta cells of the pancreas? A. GLUT4, an insulin-independent glucose transporter. B. GLUT2, an insulin-independent glucose transporter. C. GLUT2, an insulin-dependent glucose transporter. D. GLUT4, an insulin-dependent glucose transporter. The answer is B. GLUT2, an insulin-independent glucose transporter. GLUT2 is the primary carrier for glucose transport into pancreatic beta cells. It does not depend on insulin to function. It thus aids the pancreatic beta cells sense glucose levels in the blood, which are then triggered to release insulin. GLUT4 is active primarily in adipose and muscle tissue. What is the triad of presenting symptoms of diabetes mellitus in adults? A. Polydipsia, weight loss, and enuresis. B. Polyuria, weight loss, and polydipsia. C. Weight gain, enuresis, and polydipsia. D. Polyuria, polydipsia, and polyphagia. The answer is D. Polyuria, polydipsia, and polyphagia. The first onset of diabetes is generally marked by the following three signs: polyuria, frequent urination; polydipsia, increased thirst and fluid intake; and polyphagia, increased appetite. In children with type 1 diabetes, enuresis, involuntary urination, is often the first sign noticed by parents, along with unexplained weight loss and recurrent infections. What is the most common cause of primary hyperparathyroidism? A. Parathyroid hyperplasia. B. Parathyroid carcinoma. C. Parathyroid adenoma. D. None of these. The answer is C. Parathyroid adenoma. Primary hyperparathyroidism is most commonly due to a parathyroid adenoma. 80 to 90% of cases of primary hyperparathyroidism are due to parathyroid adenoma. 10 to 15% cases are due to parathyroid hyperplasia, and parathyroid carcinoma accounts for 1 to 5% of all cases. Secondary hyperparathyroidism is the result of chronically diminished levels of serum calcium. Depressed levels of serum calcium leads to a compensatory increase in the activity of the parathyroid glands. What is the most common cause of secondary hyperparathyroidism? A. Poor nutrition. B. Renal failure. C. Bone cancers. D. Pituitary tumor. The answer is B. Renal failure. Renal failure is by far the most common cause of secondary hyperparathyroidism. If kidneys are unable to convert vitamin D to its active form, serum vitamin D levels will drop. Lower vitamin D levels reduce the absorption of calcium in the intestines and reduce the kidney's ability to resorb calcium from the urine. In addition, if the kidneys are unable to adequately excrete phosphate, calcium phosphate forms, which further lowers free calcium levels in the blood. Poor nutrition is not a common cause of secondary hyperparathyroidism, though low vitamin D levels due to malabsorption can be a contributing factor. Pituitary tumors can be seen with hyperparathyroidism when part of multiple endocrine neoplasia type I, but this is not as common as renal failure. Bone cancers are more often associated with elevated calcium levels, resulting in low or undetectable parathyroid hormone levels. A 50-year-old female client is seen in the clinic for her recent diagnosis of hypothyroidism. Which of the following instructions should be included in the nurse's teaching plan? A. Explain the outcomes expected with removal of the thyroid gland. B. High protein, low carbohydrate diet and replacement hydrocortisone. C. Obtain a hemoglobin A1C test. D. The use of antiglycemic medications. E. High fiber, low calorie diet, and 5 to 6 small meals per day. The answer is E. High fiber, low calorie diet, and 5 to 6 small meals per day. Hypothyroidism usually involves weight gain, so a lower calorie diet with frequent small meals are recommended. High fiber, low calorie diets and stool softeners will help to alleviate these symptoms. Antiglycemics and hemoglobin A1C tests are indicated for diabetics. A middle-aged female client has just underwent a thyroidectomy for treatment of Graves' disease. The nurse caring for this client is aware she may need to monitor the client for what possible complication? A. Bone pain. B. Goiter. C. Oliguria. D. Tetany. E. Tetanus. The answer is D. Tetany. Tetany is a complication due to hypocalcemia which can occur if the parathyroid glands which control calcium balance are accidentally injured during thyroidectomy. Tetany is associated with nerve excitability and sustained muscle contractions, or spasms. Tetanus, bone pain, and oliguria are not associated with complications of a thyroidectomy. Goiter is a manifestation of an overactive thyroid. A 45-year-old female client with Addison's disease has presented to the client for instruction on her medication regimen. The nurse understands that the patient may require lifelong corticosteroid replacement. It will be necessary to educate the client about possible side effects of this type of therapy. Which of the following should a nurse include in her teaching plan about corticosteroid therapy? A. Monitor glucose with finger sticks to check for hypoglycemia. B. Increase sodium intake to prevent hypotension due to edema. C. Increase calcium intake to at least 1,500 mg per day with vitamin D, to help to prevent steroid-induced osteoporosis. D. The medications should be taken on an empty stomach in the morning to avoid nausea if taken with food. E. Increase intake of folic acid and B12 to prevent neurological side effects such as paresthesias of the hands and feet. The answer is C. Increase calcium intake to at least 1,500 mg per day with vitamin D, to help to prevent steroid-induced osteoporosis. Corticosteroids may lead to bone loss, especially after long-term treatment, over 3 months. Calcium and vitamin D supplementation can help prevent these side effects. The client should also be advised to start a low-impact exercise regimen if possible, and if necessary take a bisphosphonate drug. You are caring for a patient who is started on clindamycin, ketorolac, prednisone, lisinopril, and simvastatin. After receiving multiple doses of each of these medications, you notice that the patient's blood glucose is 205 mg per deciliter. Which of these medications is known to cause hyperglycemia? A. Ketorolac. B. Lisinopril. C. Simvastatin. D. Prednisone. E. Clindamycin. The answer is D. Prednisone. Of all the medications listed, prednisone is the only medication that is known to cause hyperglycemia. Prednisone has a number of side effects including hyperglycemia, acne, headache, restlessness, insomnia, nausea, vomiting, and weight gain, among others. Clindamycin's side effects include diarrhea, including Clostridium difficile, and less commonly nausea, vomiting, and abdominal pain, among others, but not hyperglycemia. Ketorolac's side effects include renal toxicity, tinnitus, heartburn, diarrhea, and abdominal pain, among others, but not hyperglycemia. Lisinopril's side effects include hypotension, lightheadedness, angioedema, and barky cough, among others, but not hyperglycemia. Simvastatin's side effects include muscle pains, aches, muscle weakness, and less frequently confusion, and electrolyte disturbances, but not hyperglycemia. You are the nurse taking care of a patient with type 2 diabetes mellitus. The patient is hospitalized for pneumonia and switched from his home medication, metformin, to sliding scale insulin, while inpatient. You explain to the patient that the specific reason is which of the following? A. To prevent lactic acidosis while hospitalized. B. To prevent headache while hospitalized. C. To prevent myocardial infarction while hospitalized. D. To prevent depression while hospitalized. E. To prevent stroke while hospitalized. The answer is A. To prevent lactic acidosis while hospitalized. A known side effect of metformin use is development of lactic acidosis, a form of metabolic acidosis. Patients who are hospitalized, especially if hospitalized for infections, like pneumonia, are independently at an elevated risk of developing a lactic acidosis. As such, to minimize the risk of lactic acidosis, a modifiable risk factor, metformin use, is frequently temporarily discontinued while inpatient. Patients on metformin are frequently switched to sliding scale insulin as inpatients, as this allows for adequate glycemic monitoring, titration, and control. Once they are stable for discharge and the cause of their hospitalization is addressed and treated, most can be safely discharged home on metformin without issue. While numerous measures are carried out while patients are hospitalized to prevent myocardial infarction, stroke, headache, and depression, the switching of metformin to sliding scale insulin is not performed specifically for any of those reasons. Which of the following is true of type 1 diabetes? A. Patients develop insulin resistance. B. Patients are typically overweight adults. C. Patients typically present in diabetic ketoacidosis. D. Patients do not require treatment with insulin. The answer is C. Patients typically present in diabetic ketoacidosis. Type 1 diabetes is an autoimmune process that typically presents in young children in the form of DKA, diabetic ketoacidosis. This potentially life-threatening condition is treated with IV insulin. Type 2 diabetes is insulin resistance, and is found in older adults, typically those who are overweight. The nurse is caring for a patient who is to receive a fasting blood glucose test. The nurse does all of the following to prepare the patient except dash. A. Restricts meals 4 to 8 hours before the test. B. Marks the patient in PO 2 hours before the test. C. Instructs the patient to refrain from the use of hard candy. D. Instructs the patient not to use any gum or breath mints. E. Stops the patient's D5 0.45 IV maintenance fluid. The answer is B. Marks the patient in PO 2 hours before the test. The patient should refrain from ingesting any material that may contain sugar prior to a fasting blood glucose. However, is not necessary for a patient to be labeled in PO as they are still able to ingest water. All other preparations should be made. The nurse cares for a patient newly diagnosed with systemic lupus erythematosus, SLE. Which of the following is a characteristic sign of SLE? A. Pain during exposure to cold. B. Blood in urine. C. Arthritis and joint swelling. D. Lesions on extremities. E. Butterfly rash across bridge of nose and cheeks. The answer is E. Butterfly rash across bridge of nose and cheeks. The most characteristic sign of SLE is a butterfly rash across the bridge of nose and cheeks. The others listed are also signs and symptoms of SLE, but the most well-known sign that is specific to SLE is the butterfly rash. Arthritis and joint swelling, hematuria, lesions on extremities, and pain during exposure to cold, Raynaud's phenomenon, may be signs of other diseases.